Hello, my name is Dr. Joshi with Prestige 2.0, and today we're blessed to have two individuals who are very familiar with the exosome space and are going to tell us a little bit about how it can benefit us and be used in clinical practice. And with that, I'd like to welcome Dr. Ian White and Mr. John Grieco.
Thank you.
Thanks for the
So
introduction.
before we jump in and really get into the conversation on exosomes, can you two share a little bit about your backgrounds and what led you into the space? Dr. White, maybe if you'd like to begin.
Yeah, happy to do so. Are you able to hear me okay? Is everything you can hear me okay?
Yes.
Yes, I'm happy to do so. So I've been in the space for over 20 years. Actually, I started in this industry studying parasites and how they interact with the immune system. And what we were studying back then, without really understanding it, was that these parasites were liberating exosomes in order to evade the immune system and have access to the host. So for a very long time, before we even knew what exosomes were, we were studying it in a natural setting. And then over the years, I became very interested in how the immune system interacted with our own damaged and aging tissue. And so over the years, I pursued regenerative medicine, particularly in the area of cardiac regeneration, and then eventually into stem cell biology, anti-aging, and longevity. And that's where we are now with studying longevity and how the mechanisms of aging can be controlled with perinatal tissues.
John, your background?
Yeah. So previously, for 30 years, I was a cardiac device rep, working with cardiologists, cardiac surgeons, helping them implant these devices. And then a colleague of mine who worked for another company sat me down one day and talked to me about regenerative science, regenerative medicine. And he suggested that I look into it. I did. I was so impressed with it that I drove in my car and headed back to Florida where I started this. So I've been in this about 10 years.
Hmm.
And in that time, I've seen quite a bit of advancement, quite a bit of acceptance in the medical community. I'm blessed in that a couple of years ago, a colleague of mine came to me and talked to me about Dr. White and his work and what he was doing at Neobiosis. So it kind of it's been really good. Been very lucky.
Well, that's interesting. I'm glad you guys have such diverse backgrounds because for those who are interested in exosomes and those who are implementing in their clinical background, there always tends to be a unique backstory that leads them to the world of exosomes. But before we get into the details of exosomes, let's start at a very basic fundamental level. What are exosomes? So, we can talk about the phospholipid bonds and all that fun stuff, but really for like the lay patient audience, what are exosomes and what are their value?
So exosomes are a way of communication that all cells, almost all cells in our body utilize. So you may be familiar with terms like endocrine and paracrine. These are ways in which the body sends signals to other extreme parts of the body, or perhaps locally. In the case of exosomes, exosomes are part of the paracrine signaling system, which means that they are part of the signaling system that extends over very long distances. And in order for a cell to send a signal to another cell over a very long distance, perhaps another part of the body, it needs to package that signal in a protective layer because the body is full of enzymes which are designed to break signals down so that we don't end up making proteins that we don't need in our body that could potentially become dangerous. They could become tumorigenic. They could become a disease. So the job of those enzymes are to look for signals that are floating erroneously in the body and degrade them. And so in order to avoid those degradation enzymes, the cell packages the message inside a bubble. And as you mentioned, it's a phospholipid bilayer, but that's perhaps too much for the audience. But it's a layer. Think of it like a FedEx box. And in that FedEx box, you're able to put instructions and raw materials like Legos, building blocks. You package it up and you put an address label, and then you send it out with FedEx, and it finds its way to its destination. Same thing with exosomes. The cell packages what we call cargo into the exosome. It signals its RNA, its proteins, peptides, lipids, carbohydrates, all the things that it needs to communicate to another cell. And then it sends it outside of its own cellular structure into the bloodstream and with an address label. And that address label is in the form of receptors that are on the surface. And when it finds the address, typically in the form of inflammation. So the address is inflammation for the most part. It then binds the cell that's the target cell and releases the information, like going a letter through a letterbox, releases the information into the target cell.
Appreciate that explanation. And I think that's important to set the background to understand what the clinical value would be. So all of that is a very nice explanation, but it inevitably leads to the so what, if you will. So that's all very nice and good to know. You talked about exosomes from the parasite world, learning how parasites can manipulate exosomes in a way that may be harmful to the patient. What you're suggesting is that exosomes are also used internally as a helpful mechanism for communication. How can we now use that to optimize the body? Because I think that there's a different component in just basic cell to cell communication versus the actual ability to improve or optimize a specific state, whether that's cardiovascular, whether that's in longevity space. Talk a little bit about the role exosomes have in that world.
Yeah. Well, of course, all forms of communication can either be good or bad. They can be detrimental or beneficial. And in the case of parasites,
Yeah.
they are trying to modulate inflammation for their own benefit at our detriment. It's just communication, it's just like words. And so when cells, immune cells, or cells that are have a responsibility in the body to fix tissue, need to communicate those signals, they also use exosomes. But in this case, the signals, the communications are positive. So when you have an injury, the response of the injury isn't necessarily local. It ends up, I'm sorry, it originates in the bone marrow. And so what happens is that when you have an injury on, let's say, your forearm, those signals have to make it to your bone marrow to then activate your endogenous stem cells to then mature and migrate to the site of injury and then fix the injury. So exosomes are responsible for mediating all that communication. You've got an injury. We are the guys that are respond to the injury. Now we're going to give you the tools to respond to that injury. We package it up just like a UNICEF aid package. They package up the aid in the bubble and they send it off to the disaster zone. And those aid packages are used locally to fix the injury.
Well said. So if we were to understand this at a very fundamental level, we could use exosomes to help improve injuries in specific parts of the body, exosomes to help reduce inflammation in certain types of the body. When you have to look at it from a practical standpoint and its clinical application, can you maybe talk at a broader level? And obviously, we can distill into further details later on, but just at a broader level, what the direct application of exosomes in specific parts of the body, either intravenously or topically, can do for a patient?
Yeah, so remember, not all exosomes are created equal. So most cells in the body use exosomes to communicate, and not all those communications are regenerative or reparative. They are just communications between cells. So what we want to focus on when we're talking about regenerative medicine are those exosomes that actually have the messages inside that communicate repair. And what we find is the exosomes that contain those messages are found in birth tissue. Because in birth tissue, like amniotic fluid, which are very robust in exosomes, there are billions of exosomes per cc, so a very small volume of liquid. There are billions of these exosomes in very small volumes of liquid, and they all have these signals saying, make a baby, but also change the physiology of the mother to improve her general condition so that she can deal with the rigors of pregnancy. So, in birth tissue exosomes, which are perhaps different than adult exosomes, the signal is build tissue, repair tissue, modulate inflammation because the baby is trying to avoid being rejected by the mother. So all of those signals, build tissue, repair tissue, modulate inflammation, can be used when you have an injury. So if you have a torn meniscus, you're trying to reduce inflammation, you're trying to reduce pain, you're trying to induce repair. And in these perinatal, these amniotic fluid exosomes contains those specific messages. And when we provide those messages, the adult body can utilize them.
So I'd like to add a personal experience anecdote to everything he's been saying. So 2 years ago, my wife fell on a very hard flooring. She shattered her patella in 8 pieces. The orthopedic surgeon wired it back together and told her more than likely you won't walk normally for 9 months. My wife walked out of there and says, I'm not buying that. So what we did at 2 months post-op, we injected 2 mLs of the exosomes. We call that Lilium Pure into my wife's knee. Not the orthopedic surgeon, another physician. And within 2 to 3 months, I would say that she was walking probably 90%. Now, every patient's different, as Dr. White will know and as you will know, but her progress was remarkable. Her x-rays, and I could always send them to you, showed quite a remarkable healing process that the orthopedic surgeon just could not explain. It was a lot faster than he thought. And 9 months out, we were in London walking 7 miles a day. And I would say to her, do you need to stop? She goes, no, I'm fine. Actually, she outwalked me by quite a lot. And by the way, every 6 months, I get 2 mLs in a IV push for my chronic arthritis. Because at my age, I'm 74, I have a lot of inflammation, and I don't take any biologics or pharmaceuticals for that chronic arthritis. I just every 6 months, what I do is I just get a 2 to 4 ml injection of an.
When an adult receives an injury, because of the aging process, we tend to heal much slower. And what these perinatal tissues are able to do is take those young signals, because when we're young, we heal very robustly and very fast. And the reason why we see these symptoms of aging is because we lose that ability to heal robustly and rapidly. But these perinatal tissues, when you're able to utilize the exosomes and the growth factors, actually accelerate the healing process so that an adult can theoretically and practically heal like they would when they're much, much younger.
Let's touch on that because I think it's a critical factor that few people are starting to realize, but is becoming very much in the vanguard of medicine. We talk about, aging related inflammation. We talk about the factors that can lead to chronic illness begin oftentimes with subtle inflammation that builds over time. What is it about inflammation that compounds over time with the age-related process? And I know that that is a very complex question, but for many patients who are just learning now for the first time that, hey, inflammation is something I need to worry about, what are some key things we can tell them to help them be aware of these different interventions that can help with that?
Yeah, well, inflammation is the king when it comes to our aging process. And if anybody's heard me present on stage about the aging process, I talk about how aging can be accelerated or slowed down depending on the status of the immune system. So there are many species that for evolutionary purposes accelerate um, their aging through the disassembly of their immune processes. So their immune system crashes very, very quickly. Now, we do the same thing, we just do it much slower. So our immune system crashes essentially over time, which causes obesity. It's one, as we get older, we put on the pounds because our body, when we are immunocompromised and our immune system is dysregulated, our body tries to repair it by making adipose. So we have a very hard time getting rid of fat tissue as we get older, in part because our immune system is dysregulated. So the immune system is a major component of the aging process. And a big way that these modalities, the exosomes and the perinatal tissues work is by modulating the inflammation, turning off the pro-inflammatory cytokines. And that's why we received an IND approval by the FDA, because we're able to control the cytokine storm associated with COVID because it modulates inflammation. And so that's a huge deal when you're talking about injury when you're older, where the immune system, which is the architect of the repair, is dysregulated. These exosomes control it in a way that it becomes almost younger, and it's able to affect a response like you were maybe 20, 30, even 50 years younger, because you have those young signals that you're missing as you're older.
Dr. White, really like what you just said, and I want to repeat it for the audience because I think this is a critical point that we need to touch on. One, you mentioned that adipose tissue development, so fat buildup in adults, is oftentimes a function of a dysregulated immune system. And I think that's critical for people to understand that your body has a very unique cause and effect system where some of the effects may be due to causes that are not immediately evident. A dysregulated immune system at a certain age can lead to fat deposits. I think that's a very critical thing for people to understand. You talked about the cytokines and part of the inflammatory response, and for the audience, probably as simple as possible. And I know that getting into the whole cell mediated and humoral mediated is a bit complex, but if you could maybe talk at a very high level some of these cell signaling mechanisms in inflammation and how exosomes can help with that, I think that would be really helpful for the patients to understand what's the real value that exosomes can provide to help counteract a lot of these age-related inflammation that may take place.
Yeah, so let me take
And
a
I
step back.
apologize for asking such a long-winded question.
No, it's okay.
Yeah.
I'm happy to try to address it. But let me take a step back first and address the inflammation with aging. What and you mentioned that there are a lot of aspects to obesity or weight gain that we are just not really aware of. And I'll give you another example, that sugar consumption. So first of all, if anybody's out there that's looking to do anything for their health, anything for their aging, the first and most important thing that they should ever do is cut out sugar from their diet. All sugar, all sugar as much as possible, even fructose, which comes from fruit. So fruit should be consumed in moderation, just like everything else. But fructose is one of the worst sugars for
Even
you,
liquor.
unfortunately. And the reason is because it's incredibly inflammatory. So a lot of nutritionists think that the obesity problem in the United States is caused by caloric imbalance, where you're consuming too much sugar, you're consuming too much energy, and you're not exercising enough. So that caloric imbalance means that our bodies are storing that energy as fat. But we have not evolved to do that. We're not brown bears, and we're not blue whales. We don't store fat in order to build blubber. That's not how our biology works. But what the way that our biology works is that when you assault the body, when you injure the body's response is to make adipose, because it's a bioactive material, and it's also high in energy, and it's also high in lipid. A lipid is what you use to make new cells. So when you're injured, you need to make new cells, and you need an energy source to do so. That's where fat, lipid comes in. So when you consume a lot of sugar, that sugar causes glycans, these cross links that sticks proteins together. When those proteins are stuck together, you cannot reverse it, and they become very inflammatory. So all the sugar you eat cross links those proteins, and then you have an immune response against those proteins. That immune response builds your adipose. So that's one way where we're building adipose without really realizing it. So then going back to your other question, how do we deploy exosomes in the context of inflammation? Well, one of the major roles of exosomes in the developing body is to look for inflammation and allow it to do its job, because inflammation is important. You need, when you have an injury, you get an inflammatory response, because on the backside of that inflammatory response, you get repair. When you cut yourself, it becomes inflamed, it's painful, and then it repairs. This is the natural response. But when you have autoimmune disease, that's when the immune system doesn't stop. It just keeps going, and it feeds itself. It keeps getting worse. And that's where cytokine storm comes in with COVID. It's an out of control immune system, which is causing more damage to the body. So, what these exosomes are able to do from birth tissue is say there's too much inflammation. And I'm going to make cytokines, I'm going to make these proteins that reduce the inflammation so that the body can start now fixing itself instead of being stuck in this loop of tissue damage. Because the more inflammation you get, the more tissue damage you get, the more tissue damage you get, the more inflammation you get. That's how autoimmune disease works on a broad scale. So these exosomes are able to recognize that inflammation, bring it down, give the body a chance to breathe, catch its breath, and then start the reparative process.
I'm having flashbacks or possibly nightmares of M1 complement mediated immune responses. So thank you for taking us back to those fundamentals.
That's exactly it.
I want to now maybe transition a little bit to the clinical applicability of exosomes, because I think now that we have a pretty firm understanding of the mechanism behind exosomes and the value that it provides, I want to talk a little bit now on the symptomatology of it. Dr. White, whenever we talk about these novel types of therapeutics, there's always the pathophysiology, and then there's always the symptomatology, and there's usually a disconnect, and that's why drug development, therapeutic development takes as long as it does, because things require layer upon layer of evaluation. When a patient undergoes exosome treatment, what are some of the physiologic benefits, and what are the symptomologic benefits that they can experience?
Well, we are working on some clinical trials, and we do a lot of case studies that are consented by the patients, and we're able to get information back from them about their experience. And what we're finding is that rather than, if we're talking about perhaps a knee issue of some kind, rather than using a pain blocker, an analgesic where you're simply addressing the symptom. The body says, I have pain, and the physician says, I have something to block that pain. You're not really getting to the root cause. And in fact, pain is our friend. Pain is telling us that we have a problem. And without pain, we would survive a very short period of time because we would be banging our heads, banging our knees, cutting ourselves all over the place. So when our body experiences pain, it's telling us, hey, we've got a problem, let's fix that. But the way that the medical healthcare system is set up today is just to send people home. Give them something to make them happy, and then they'll come back and they'll pay again at a later date. But with regenerative medicine, we actually treat the root cause. And the root cause is usually some kind of disease. There's an injury, there's damage, and we can reverse that damage by giving the body the signals that it no longer has as an adult. When we're a child, our reparative ability is up here. When we're an adult, it's down here. And we lose that ability as we get older. But when we give these signals, we can suddenly repair like we were younger. And so the symptoms go away because we've repaired the underlying cause. We're not just blocking the symptom, we're not just blocking the pain. Does that answer your question? I hope it.
I think to a certain degree it did, and I want to maybe touch on that point as well. Who are some of the patients that would make great case studies to benefit from exosomes? Can you talk a little bit about ideal use case scenarios?
Well, the products are used across the board, which is quite amazing because it has a huge, very broad application. Um, the mechanism of action means that it's not just a targeted approach, it's a very broad approach. So it can affect the entire immune system, which can then affect the brain, it can affect the heart, it can affect the kidneys, it can affect all these different tissues because they're all responding to the same or require the same signals. So what kind of patient utilizes these? Well, we've had a lot of success in professional sports, for example, a traumatic brain injury. A lot of quarterbacks in the NFL have used these products after receiving a concussive event, and the inflammation is brought down very, very quickly, which means that they don't end up having to stay in the concussion protocol for as long because the inflammation is mitigated almost immediately. Also, I can't talk about names, but there was a quarterback injured last year. He tore his Achilles tendon, and everybody was amazed by how quickly he was healing because he was receiving these exosome products in his Achilles, and it healed
Hmm.
incredibly rapidly. So, and those individuals that are combining modalities, so exosome therapy perhaps, but also in conjunction with hyperbarics or red light therapy or peptides, these are all very synergistic. They provide the body with the tools and the resources it needs to heal because the body knows how to heal. The problem is, as we get older, we lose that ability. That's why we age. That's why we have these
Yeah.
wrinkles and symptoms of aging. We lose that ability. And what these products do is just give back the resources the body needs. And then it remembers, I know how to heal myself. It uses those raw materials and it heals much, much faster than it would otherwise.
Well said. John, I want to maybe give you an opportunity to speak on that as well, because in your experience dealing with different provider groups across the country, seeing different patient outcomes, what are some of the ideal use case scenarios that you've seen? And you can talk kind of all across the board in different case studies in terms of injury, neurocognition. Some of the things I've seen is in the cognitive impairment space, those who may be experiencing the first signs of neurodegeneration. Can you talk a little bit about some of the use scenarios that you've seen?
Well, I've seen that all across the board, all over this country. I'm fortunate I've got clients, excuse me, in Southern California, Florida, New York, and we have quite a big clinic down outside of San Diego, and that physician uses exosomes in conjunction with other injuries, such as rotator cuff injuries. As an example, he does a lot of that. So, what he'll do is he will use the exosomes in an IV, and then he'll use another product of ours as a direct injection to the rotator cuff. And I don't know if I should bring that up, that might complicate this. But essentially, I see that a lot. I've got a client down in Hallandale, Florida, and she uses exosomes, believe it or not, in uh, vaginal problems, penile problems. She uses that. But I have to say the most often used modality is really orthopedics. Like I told you about my wife, we see that all the time. And some people also will will use it. And I've got a client in Largo, Florida, who what they're doing with their long-term COVID patients or even RSV. And I don't know if I ever told Dr. White this, but so what they're doing is they are nebulizing the exosomes. So they'll take a nebulizer, they'll put in maybe 4 mLs of normal sterile saline, and then they'll put 2 mLs of the exosomes, and then they'll have the patient nebulize that, through their nose, and the response is pretty good, pretty quick, and that's pretty new. I've seen people start doing that about a year ago. So there are just many ways that these products can be used. So I have a physician whose daughter is epileptic. She has epilepsy, okay? And he administers 4 mLs of the exosomes plus uses an agent to cross the blood-brain barrier every six months or 4 months. And that's something I don't talk about a lot because I think that's a little bit out of the realm of what we normally do. But I am telling you, there are people use this product in all different ways. I have a physician in New York who actually, maybe Dr. White can explain this to me better. She uses exosomes for type 2 diabetics. So that's been my experience. I never recommend anything to anyone because that's something we as distributors should never do. But if someone says, hey, I want to do this, what do you think? Then I'll go, Dr. So and so does it, or this doctor does that. And I even allow them to get a hold of my accounts and say, hey, John told us you're using exosomes for this. Tell me your outcomes.
I
So
can get
hope
I
that
can give
answers
another
it. Good.
real world experience of something recent, actually, if that's okay. So we had an emergency situation where we had a patient that was burned over 70% of their body. We actually have been studying the effect of these products on burns, thermal burns. The patient had received burns over 70% of his body, and he was given a 3% chance of survival. He had 4 kids,
Wow.
a wife, and provider applied the product as a spray topically over the entire body. And whether or not the product saved his life, we won't know. But with a 3% survival rate, with a 70% burn like that, he survived. And you can see some of our other work on burn victims as well. These products are very antimicrobial, so burn victims are susceptible to infection, but this product is very antimicrobial, so it helped in that area. It reduced pain. It's an analgesic, so it was able to reduce that pain very quickly, and also reduce inflammation and induce repair. So it's sort of like this perfect synergy of everything coming together, and it works incredibly well topically for burns.
Thank you, guys.
So let me just add one more that I experienced yesterday. So we have one of our products is used for aesthetics, and yesterday I had an esthetician give a facial to someone whose skin's a little rough, and so what she did is she essentially brushed the exosomes on and then microneedled, and within an hour or two you could see a difference. Now she's going to have to take another set of pictures in 2 weeks. But the reason for that is the inflammation in her face was reduced almost immediately. So there's so many different uses for this that in a way it's almost hard for us to catalog it all.
Yeah, well said. I think in the remaining time that we have, could you guys talk a little bit about the future of exosomes? I think that as it becomes more prevalent, the use cases will arise, but maybe if you guys can cite some prominent clinical studies or some regulatory trends that might change the general applicability or overall perception at a more macro level of exosomes, that would be very helpful to learn.
Yeah, John, do you want to go first, or shall I jump in?
Well, let me just give you something that happened back in December, and then I'll tell you why it occurred in my estimation, and then Ian will expound on that. Recently, and you were there, by the way, at the A4M meeting in December, we had the largest showing of physicians and clinicians that meeting has ever had. It was just, we were so busy. I mean, we were there till 7 at night, and we started at 9 in the morning. So the common theme that I got from that meeting was that the providers felt that the environment in Washington was going to change and that there would be maybe not where the FDA or HS would come out and give everybody a papal blessing, but everyone is enthusiastic to the point that they feel there will be less um, regulatory, I don't know what the word I want to use,
Oversight?
Oversight.
oversight. Yeah, I mean, and that what that happened in December has rolled over in today, and I think Dr. White could give us some more information on that also.
Yeah, well said, John. I mean, we've never been busier. This is the busiest time that we've ever experienced because so many healthcare providers are excited about these modalities. So, that's great for us. We started in this industry trying to bring transparency and rigor. Unfortunately, this industry is still plagued by bad actors, and they're out there today. They heavily market. They have very aggressive sales reps, and it's very hard for anybody that's interested in this space to sort of know where to go, because if you make a mistake, it could be problematic for your patients. And so that's why I spend a lot of time on the stage. I was on the stage in A4M. I do that every year, trying to communicate that there are alternatives to these heavily marketed products. There are rigorous scientific products out there. We publish, we have an IND, and so I'm very confident with that moving forward. But with that said, I also advise on scientific boards like at A4LI. I also advise on the various other health span initiatives. I go to DC, I talk to lawmakers about how these products should be regulated. I've worked with the Bahamian government, and they recently changed the law in the Bahamas to reflect the need for access to regenerative medicine. They changed the law.
Yeah.
It went into effect on September 4th of last year to allow physicians access to regenerative medicine without FDA approval. Utah just did the same thing. Texas is next, then Florida, South Carolina. All these states are starting to recognize the potential of regenerative medicine and understand that the roadblocks that we've been facing with the federal government are unfortunately unrealistic, and we just need a way forward. But We've got to remember the bad actors are still out there. So we've got to find a pathway forward, at the same time prevent the bad actors from having free reign over the market. And I think that's
Right.
about to happen with the new administration. So we have a new Secretary of Human Health Services. We have a new FDA director coming in, and they understand the potential of these modalities. They understand the need to get these modalities in front of patients. But importantly, they also understand there are dangers when these products are not manufactured and deployed correctly. So, if we can continue working with the lawmakers, with the decision makers, and say these modalities work, we need to make access more broad, but at the same time, we need to be careful. Safety, efficacy, these are the two things that are the most important. I think as long as we keep those in our sights, that we're going to be able to bring and roll out these modalities to a greater population. And it's really everybody on this call, everybody in the United States. When I fly over the United States, if I'm going to a meeting and I look down and I see all those lights, I realize that everybody down there can utilize regenerative medicine at some point in their life. And it's my responsibility to make sure that those modalities are safe and they're effective.
Well said, guys. And with that, I'd like to thank you both for your time and look forward to implementing exosomes at Prestige and continue to seek your guidance as we start to treat more patients.
My pleasure. Thank
Thank
you for
you for
having us.
having us.
Thank you.
Great. Thank you.